step into the extraordinary universe of regional anesthesia, pioneering within the medical field as it astonishingly modifies conventional surgical procedures. Envision a stage post-surgery without confusion or unease, a victory earned by refraining from the use of general anesthesia. Instead, picture a peaceful recovery period. It may seem unlikely, but this is the intriguing reality shaped by the diverse techniques of regional anesthesia. Find the concept of regional anesthesia perplexing? This innovative anesthetic method is designed to numb a specific area of the body undergoing surgery, allowing the patient to stay awake and calm throughout the procedure. Its minimal side effects and significant contribution to a faster recovery are praised worldwide. To broaden our comprehension of this radical advancement in anesthesia, let's explore its various types. 1. Spinal anesthesia. This type involves administering an anesthetic injection into the protective sheath of the spinal cord, resulting in lower body numbness. 2. Epidural anesthesia. This form is most commonly used during childbirth and surgeries involving the legs and hips. It requires the injection of an anesthetic into the epidural space within the spinal cord, causing numbness below the injection point. 3. Nerve blocks. This approach is utilized for surgical procedures on numerous body parts, including the shoulders, elbows, wrists, hands, hips, knees, and ankles. The anesthetic is injected around the nerves carrying the pain signals from the operation site to the brain. 4. Intravenous regional anesthesia, beer block. This technique involves injecting an anesthetic into a vein in the arm or leg. A tourniquet is then applied post-injection to prevent the anesthetic from dispersing through the body. These advanced methods find extensive application in a variety of surgical procedures such as hip and knee replacements, hand or arm surgeries, and childbirth. As we delve deeper into the realm of regional anesthesia, we encounter an advanced version known as Regional Anesthesia Plus. This method combines the effectiveness of regional anesthesia with a supplemental sedative or analgesic to provide an enhanced level of comfort during surgery. What sets Regional Anesthesia Plus apart from regular regional anesthesia? While the fundamental concept remains the same, numbing a specific area of the body, the addition of a sedative or analgesic elevates the process. This combination not only ensures the patient experiences no pain, but also induces a relaxed state, making the surgical procedure more tolerable. Regional Anesthesia Plus is particularly beneficial for surgeries that may induce anxiety or discomfort despite the numbing effect. For instance, imagine undergoing a shoulder surgery where you witness the procedure while being fully aware of your surroundings. However, with the addition of a sedative, you're not just numb but also in a relaxed state, making the experience less daunting. Furthermore, this method can be tailored to suit the patient's needs and the nature of the surgery, making it a versatile choice for medical practitioners. Regional Anesthesia Plus, taking pain management to the next level. It's not just about avoiding pain, but also about ensuring a comfortable surgical experience. So as we proceed further into the world of anesthesia, let's keep in mind this advanced technique and its potential to revolutionize surgical procedures. In today's episode, we're diving deep into the extensive field of anesthesia, exploring the various types, each with their unique benefits and applications. We'll examine in detail what each type involves, how they operate, and the common scenarios where they're utilized. In Scene 2, we'll focus on regional anesthesia. Simply put, regional anesthesia is a method that numbs a specific area of the specific area of the body, allowing the patient to remain awake, yet feel no pain in the numbed region during surgery. It's like possessing a superpower where surgical procedures can be endured without feeling any discomfort. Moving on to Scene 3, let's discuss IV sedation. IV sedation is a distinct type of anesthesia where the patient is sedated but remains conscious throughout the procedure, achieved by administering drugs through an IV line, allowing the patient to be in a relaxed state. This type of anesthesia is often utilized for minor surgeries and procedures, proving to be a practical option when full-body numbing isn't required. The main difference between these types of anesthesia is their scope of application. While regional anesthesia is specifically designed for surgeries involving particular body IV sedation, is typically preferred for less invasive procedures. Understanding these distinctions helps us appreciate the advantages and the brilliance of regional anesthesia. Stay connected as we delve into more interesting aspects of this subject in our fourth scene. Before we delve deeper into regional anesthesia in Scene 2, let's first establish its relationship with general anesthesia in Scene 1. As two main categories of anesthesia, both have pivotal roles in the medical field. General anesthesia, presented in Scene 1, is akin to a medically induced coma, not sleep, resulting in a completely unconscious and unresponsive patient. It's typically employed for major surgeries or procedures that could lead to severe discomfort. Regional anesthesia, which will be our primary focus in Scene 2, numbs a specific portion of the body. This allows the patient to remain awake, yet experience no pain in the area being worked on. Appreciating differences between these two types of anesthesia is key to understanding the unique benefits of regional anesthesia in Scene 2. With this framework in mind, let's delve into the workings of regional anesthesia in Scene 2. Moving on to Scene 5, we will simplify the concept of regional anesthesia. This method is primarily utilized to control pain during surgical procedures. It comprises the delivery of a local anesthetic injection near a cluster of nerves, resulting in numbing a specific body part. Consequently, the patient remains conscious with no sensation of pain in the zone where the surgery is being. In Scene 6, envision the human body as a complex chart, segmented into diverse regions. Every region represents a distinctive nerve cluster. Should a surgical operation be necessary in the leg zone of this chart, the anesthetic would be aimed at the nerve region associated with the leg. That the anesthetic would solely numb the leg zone, leaving the rest of the body chart unscathed. In Scene 7, we're looking at the benefits of regional anesthesia compared to general anesthesia. The foremost benefit is targeted pain relief, leading to lesser side effects such as nausea and dizziness. It's also celebrated for ability to speed up recovery times. It's common for patients who undergo procedures with regional anesthesia to leave the hospital on the same day of the procedure, returning to their normal activities at an accelerated pace. Noteworthy advantage is the potential for sustained post-surgery pain management. The strategic placement of a catheter at the injection site allows for pain relief lasting several days after the surgery. In our 8th scene, we conclude that regional anesthesia is a technique that utilizes local anesthetics to numb a specific body part. This clears the path for surgical procedures without the complications and recovery times associated with general anesthesia. It offers efficient pain relief and could potentially offer sustained pain management post-surgery. Welcome to Scene 9, where we delve into how regional anesthesia is radically changing the surgical process. It's not just about making it a more comfortable experience, but also about reducing the intimidation factor. So the next time you encounter the word surgery, keep in mind there's an alternate route that could streamline the whole process, making it more bearable. This is the new era where regional anesthesia is redefining the surgery landscape, improving the patient's journey, turning apprehension into relief.